we know that more than 95% of patients with metastatic colorectal cancer show MSS status, so these patients are currently not eligible for treatment with first generation PD-1 inhibitors or combinations with CTLA-4 or PD-1 inhibitors. However, a lot of effort is ongoing to investigate potential new strategies to sensitize immune cold tumors and MSS tumors, and so to bring immunotherapy to this very large proportion of patients with metastatic colorectal cancer. So in this particular case, EP4 inhibitors show a specific mechanism of action and block the receptor of the prostaglandin E2. So this is able to induce and unleash a very potent interferon gamma response in the tumor, providing a higher T-cell infiltration. So there is a strong rationale for combining these agents with PD-1 inhibitors. So this was a phase 1b study investigating an EP4 inhibitor with balstilimab, which is a standard PD-1 inhibitor. So basically several doses of this agent were investigated, and the 90 milligrams twice daily dose was selected as the recommended phase 2 dose. But most importantly, the activity of this combination was encouraging, since there was almost 18% overall response rate with this combination, and we should consider that the expected response, tumor response with the anti-PD-1 monotherapy is basically zero.